We are honored to be joined by Justin Johnson, Director of Clinical Services at the New Jersey Sharing Network. Justin, good to see you.
It's nice to see you too. Thanks for having me.
Our pleasure. And by the way, you follow our programming, you know that we've been doing public awareness around organ and tissue donation for many years now. You'll see the website up for the New Jersey Sharing Network to inform people who want to know more about organ and tissue donation. Describe your job, Justin, at the network.
Yeah, as the Director of Clinical Services, my job is to work with the staff and the people involved that are out in the field, helping facilitate donation, talking with families in this time of a passing of a loved one, and offering the gift of life to give to someone else, and just working with them to be compassionate and eager and dedicated to work with those families and guide them through the decision of donation.
Justin, we're taping in the middle of March. It'll be seen after that. Things change all the time. But as we speak right now, how would you describe the impact of COVID, even with the vaccines out there right now, more and more people getting vaccinated? How would you describe the impact of COVID on organ and tissue donation for a year plus in?
Yeah, at first it was a lot of unknowns. But we kept our operations going and wanted to be resilient during this time to still be able to offer the gift of life during, just a tough time for everybody because there were so many unknowns. And throughout that, the generosity of the people in New Jersey to be able to say yes to donation during a time where for us and anyone involved, when everybody's struggling about safety and that, for us to keep our operations going was just remarkable. And for those families to say yes to donation was truly outstanding to us.
We were having a conversation the other day with Joe and Elise and Carolyn and the team at the Sharing Network. We're just talking about a whole range of things. I don't want to give anything away. We'll be doing future programming out in the field in the not too distant future about some pretty, you're smiling because you know what I'm talking about. It's going to be an exciting time this summer in New Jersey and across the nation as it relates to organ and tissue donation. But that being said, I want to ask you, in that conversation, they said that organ and tissue donation is up. And by the way, you can do it on your driver's license. If you go on the website right now, the Sharing Network website, you can see it. But here's really what I'm trying to get at. Do you believe, as you're talking about people being obsessed with being safe and protecting themselves and others around them, that they were less committed to or interested or caring about organ and tissue donation? And if that's true, then how the heck did the number of donations, organ and tissue donation, go up, or people who signed up?
I think there's a call to action. As in this time, the people in New Jersey were just more giving. I think in this time, it was, what can I do? How can I help? And I think with being able to offer organ and tissue donation to those that when their loved one may not have had COVID or whatnot, and still be able to save lives was truly, something that we could rally behind. And I think the people saw that as a positive to be able to rally behind that.
For people, of all the years we've been doing this, Justin, I still hear, there's so much talk about misinformation and confusion around COVID. There's sometimes misinformation and still confusion around organ and tissue donation. So let's go through a few things. I don't want to assume, by the way, if you want to see previous interviews we've done on this topic, our website will be up, steveadubato.org. Check them out. Check it out. But I want to try this. Those who think that if they have a loved one who's sick, very sick, and toward the end of their life, that the Sharing Network swoops in or somebody comes in to start talking to them about organ and tissue donation in a way that may be uncomfortable for them. That's not the case.
Correct. No, it's not. And it's an opportunity. It's a way for us to offer a legacy for someone to leave at the end of their life. And what greater way to honor that by giving life. And we do so much of our work around making sure everything's safe. We do certain testing and certain things to facilitate donation in the safest way possible. And that's, to also eliminate those myths that are out there when people really feel like they can't have an open casket funeral when you can. And certain things, everything we do is surgically done in the operating room and with care and concern. And we're there from beginning to end. And we also rally behind that community to have those, they become part of our family. So we have a lot of outreach, a lot of things that we do here at the network, and and it's big, and it allows for families to heal with losing a loved one.
Tell folks about the religious side of this who think their religion, not who think, who believe that their religion may bar them from saying, I want to donate my organs to give the gift of life to someone else. Go ahead.
Right. And with that, as we know, in different religions, that there's no anything documented about being against donation that's out there. And giving life is the greatest way to show gratitude, to show love, and that's really, when we think about religion, what we rally behind in it, in our beliefs. That's
interesting the way you frame that. Let me ask you, one of the things that struck me over the years when we've been out there for the 5K or the other activities that are public, and I get to meet people who've lost loved ones. Many times they've lost a child, and a decision was made to give the gift of life, organs and tissues of that lost child to so many others. And then they wind up, you ever see them connecting again with the person who now has those organs? That is powerful, emotional, and poignant. You've seen it as well, haven't you?
I have. And next to getting married and having my own children is the most powerful moments that I've ever been a part of, to see a mom listen to her son's heart in another man's chest and know that gentleman has, more life because her son was able to give life at the end of his. Those moments are so moving and touching that it's remarkable.
And again, when we're talking about children, we hope and pray that never is the case, but when it is, those parents have to make those decisions. But for others, for those of us who are healthy and who have signed up and said yes, what about for those who say, listen, I don't want to think about organ and tissue donation while I'm healthy, while I'm doing well. I'll think about it later. And again, we're not advocating or pushing, but what do you say to those folks who say it's not the right time for me, but I'd like to do it at some point down the road? What are the pros and cons? I got a minute left before we finish up.
There's never the right time, but at the end of the day, we have to think about who's going to be left behind, and them having to, you want to take that pressure. There's so many decisions that have to be made, that's one decision that can be given to your family so they know. You can register, or you can just let them know. That way they can make that decision at the worst time of their life. No one wants to think through that when they're grieving, when they're hurt in that pain. So it's definitely take that lead for your loved ones to not have to make that decision for you.
A few seconds, 1 to 10, how gratifying is your work?
10, I would say 20.
Yeah, I'll tell you, it has been an honor as a broadcaster, but more importantly as a person. And my wife donated her kidney many years ago, and I saw it firsthand, the impact that it had. So I want to thank you, Justin, and the team at the Sharing Network. Keep doing what you're doing every day, and we appreciate you joining us. All the best.
Thank you. My pleasure.
I'm Steve Adubato. It has been my honor to be with you, and check us out again next time.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by Horizon Blue Cross Blue Shield of New Jersey, PSC&G, NJM Insurance Group, Englewood Health, Investors Bank, Summit Health, the New Jersey Education Association, the Healthcare Foundation of New Jersey, and by NJ Best. Promotional support provided by Meadowlands Chamber and by New Jersey Globe.
NJM Insurance Company has been serving New Jersey policyholders for more than 100 years. But just who are NJM's policyholders? They're the men and women who teach our children, the public sector employees who maintain our infrastructure, the workers who craft our manufactured goods, and New Jersey's next generation of leaders, the people who make our state a great place to call home. NJM, we've got New Jersey covered.